I am just making this video for you to support your massage for the elderly training, and also if anybody else would like to massage their friends, family of their lovely elders. So I'm starting off with an oil demonstration, but you can do an adaptation with clothes as well. So you don't have to do it in this way. You can do it through clothes, which would be, well, you'll see it would just be more squeezing and rubbing. And so perhaps we'll start off like this, and then we'll do a little adaptation with clothes afterwards, and then you can see. So essentially what we're doing is a very soothing treatment. We're not doing so much deep tissue, but we always check in with our guest to make sure that they are comfortable and that the pressure's okay and that nothing is too strong. Especially we're going to check if there's any allergies or skin conditions or weaknesses in the bones. So all of those consultation processes will have been done, and then you want to get your guest very comfortable. So I've made sure that my guest is very comfortable. I have selected a Walida massage oil. I've selected the Arnica one. This is really nice for soothing tired muscles. So it's pretty much a good one for everybody. So I'm going to start with a few pumps, and then I'm going to bring my hands just to the shoulders. So it's not dissimilar to an Indian head massage, but I'm just not going to be as strong or as vigorous as an Indian head massage. It's very much about soothing. It's very much about the benefits of touch, and it's very much about that relaxation and connection for our guests. So I'm just doing nice effleurages to begin with. I might move the camera around shortly, actually, just 1 second. So that's my effleurage. It might be beneficial if I just, no, it's all right, I can talk you through, it's fine. So at the back here, I'm just using the heel of my hand. Actually, I am going to move, just 1 second. Let me just move this over. Excusez-moi. Oops. I'll get this edited, I think. Here we go, that's better. Let's just do that for a minute. So I'm going to just lovely circles with the heel of my hand, and you can do whichever way you like, but I'm just using the heel of my hand around and around in true fine-tuning style. You have my dogs barking in the background. If you're a regular to my channel, you'll know about that. So I'm going to do that, and then I'm going to do that the other side. So look, I'm going to improvise. There's no set routine, because if you're a massage therapist already, you'll have the skills and knowledge to do your effleurage and petrassages. Probably won't be doing any percussive techniques here. And then thumb circles, thumb circles, thumb circles. Nice. You can do knuckling. I'm going to put a little bit more oil on. This is just a nice sequence rather than doing a full body massage and getting your guest lying on the table. If you're going to get your guest lying on the table, then you should be a level 3 massage therapist and doing a full body massage, just as you know. This is for the massage for the elderly, where you don't have to have a level 3. You don't have to have a level 3 massage qualification to do this. This is just a nice, simple offering. So here, just knuckling. I've got my thumb anchored. I don't know if you can see that. My thumb is down and that allows me to undulate my knuckles there. Is that pressure okay?
Yeah.
Yeah. So, you know, sometimes we can go stronger, sometimes it's enough, but like I said, this is just really soothing. This treatment, this massage is soothing. I'm doing a hand over hand with my knuckles, sort of like a closed fist over the trapezius. And then again, heel of the hand here, heel of the hand. Let's just go to the other side and do that again. Knuckling. Knuckling. Heel of the hand, heel of the hand. Knuckling. It's always good to keep two hands in touch. Heel of the hand is nice. And then closed fist. There we go. I feel a little bit of crunching here, that's okay. I'm going to go over and over it. Okay, so just close this. We'll do the neck. Just soothing round. So we'll call this circles and stripes, where you can do circles and then just stripes is just with your thumb. So my fingers aren't doing anything, we're just pushing away and pushing away and pushing away. I'll do it on the other side, you'll see it clearer. Just come around this way. So yeah, we're going to circles here. And then stripes. Keeping my hand in touch here. Okay. So depending on how long you wanted to make this, you can then, so you can continue doing any variation of that. Just soothing with the heel of your hand, knuckling, thumb circles, closed fist trapezius, like pulling like that. I think that's fine. Just that. You can do thumb lifts is nice. Lift, lift, lift. And lift, lift, lift like this. And then, so if you feel that a little bit of percussion, I would just do a very gentle hack. I wouldn't be going heavy with techniques, but you can do just a gentle hack. Have your fingers open so it gives it a nice bounce. And then nice iron down. So I'm going to bring the camera back to where we were and show you a bit of arms. Oops. There we go. So for the arms, just coming down. And I think I've shown this in a previous video, if you've checked out my previous video. But just soothing, always supporting can do nice juicy squeezes as well. Keep it juicy, so not pinchy. So make sure you have your whole hand doing that squeeze rather than your fingers, because then that makes it a bit pinchy. It's always lovely to do hand massage. If I just go this way, you should see this, just spreading with the back of your hand. Turning over. And just to be, you know, with our older guests, we want to make sure if they have any arthritis that we go cautiously and gently around the joints here in case there's swelling or any acute inflammation around the joints. So we just do a nice squeezing here. I'm not going to do anything too much mobility, but it's nice just to put pressure and apply pressure. Okay, we do the same this side. Let's have a tiny bit more oil. So always supporting that allows for total relaxation. Nice squeezes. So this can be done if you're working as a carer in a care home and you know your guests are seated for the day. You can go around and just do gentle squeezes. You can just do gentle hand massages. You don't have to do the whole lot of this. You can just be working, just doing forearm and hand massages is very, very reassuring and very comforting. So it doesn't even have to be as much as this. You see that, so spreading the back of the hands. I'm gripping quite strong. I am putting quite a lot of pressure here, so the pressure is very reassuring. Sometimes you can do this movement, it's like rubbing two pennies together along the flat of the fingers and the sides of the fingers and thumb, squeezing at the nail bed. So you see I'm rubbing. So there's various techniques, like depending how mobile and how flexible the hands are. So if there is any curling or arthritis, it's quite nice. As long as it's not painful, then it's quite nice to put pressure and to encourage that opening, obviously without forcing the joints at all. Yeah, that's nice. Good, okay, so I'm going to move into just working. Again, this could be done if your guest is clothed. This is, I've got a bolster here with a towel wrapped round it, but you could take a large bath sheet and just fold it in half and fold it up. And this is nice just to be able to support the neck. So let me just move that round a little bit. There we go. So this rolled up towel, and this just supports the neck so that we don't have any hyperextension. Now there's not much oil on my hand at the moment, and I don't want so much oil on my hand for the face. I don't want to slather any oil. So this is just nice sweeping and sweeping. This is just lovely, this. Yeah. And I think that, you know, as long as you have developed and instilled a relationship of trust, this is so relaxing. And as long as you have told them what you're going to do, and there's lots of reassurance, and that's part of the training, is, you know, you might have residents in your guest home or your residential home that, you know, can be quite confused or infirm. So you want to make sure that they are fully supported, fully physically and emotionally supported, so that they feel and trust what you're doing. You tell them exactly what you're doing. But this is so nice and soothing and very, very relaxing, just working all through the cranial nerve pathways, the trigeminal nerve and the facial nerve, all the cranial nerves that descend from the brain through into the face and the head and the body, so the vagus nerve, etc. They're working on the nervous system, and then just working on the muscular system as well of the face. Nice, just squeezing along the brow. Nice. And then I'm just going to travel down the nose and come back to the sinuses, either side of the nose here. This is an acupoint called large intestine 20 that's very good for any congestion. I'm just like a little pulsing here, and then I'm coming down through the zygomatic bone and the zygomatic arch at the top of the masseter muscle. I'm just going to massage around the cheeks and the masseter with little circles here. Coming forward onto the jaw, pulling back. There's lots of lymphatic nodes, the submandibular, submentalis. Pulling back towards the preauricular nodes, and then you can always just use the back of your hands to come down in front of clavicle and pump the terminus. This is good for lymphatic drainage. So don't worry about all the technicalities, it's just nice to be able to soothe. Certainly, if your residents are seated all day, this is lovely just to have that nice bit of contact and release of tension. Okay, so massaging the ears is really nice. There's lots of nerve endings and acupoints here as well. So massage the ears. And then I'm going to take this away. I'm going to, again, just block my hands so that I have no oil on. Because perhaps, sometimes with your... Actually, let's just do a squeeze first. With your residents or guests, sometimes they don't necessarily get to wash their hair as much as if, if they're at home living by themselves and completely mobile, then yeah. But I would avoid getting too much oil in the hair for older guests. I'm going to go on the diagonal. I'm squeezing here, just a nice bit of pressure. So you certainly want to be checking in with. So here I'm going to do a bit of a vigorous rub. I'm just using my fingertips, but I'm not going full on here. When we do Indian head massage, it can be quite vigorous, but in this situation, I'm just going to do some nice, gentle, but firm. My fingertips are curled. I'm using my fingertips and not my nails here at all. And then just move that around a little bit this way. There we go. And then I'm just going to do a nice, deep, relaxing conditioner style head massage. And again, you can gauge, this might be too much for people. You can really just, I just think that not invasive, it must be super, super relaxing. So things like the techniques that we've done before where we're doing scrunching, we don't really need to do that. I'm just going to put some pressure and pressure. I just think too much invasive knocking and scrunching and hair pulling and things is a bit too invasive. What I do have, which I'll show you, is there's various types. There's the gua sha combs, which are very nice. This is lovely. This is, again, using a tool. You can just use any brush or comb just to brush through. It's a bit different from having just a brush, but it's that. I've also got a wooden piece as well. These wooden pieces, if I can show you there, that's a wooden gua sha. That these are sort of head massagers, which is nice to use the tools for older guests because it feels perhaps less invasive, and it depends what your relationship is like. as well with your guests, whether you're working in a residential home or whether you're working with friends and family or in your business or in your practice. Sometimes it's important to keep that professional relationship and that professional... Oh, sorry, someone's in my house. Someone's in my house, it's my husband. Okay. So we will do plenty of that because it's nice. Does that feel nice?
Yep,
Yeah, it's really nice. And as described, it's sometimes just to not have your hands all over feels good. Okay. So from there, I would say I'd probably leave it at that, and then always nice to place your hands upon the shoulders just to finish off. And I always end my treatments by saying thank you so much. What I'm going to do here is I'm just going to blot. I'm not going to take too much of the oil off, but I'm just going to blot it because I'd like to just show you with t-shirt or with clothes, just so that you can adapt this. You know, if you're just doing an activity in a residential home, you know, if you're a carer for older people in their own homes, this is lovely if you wanted to. And if you're having older guests to your practice, this is lovely. Say, for example, you're just doing an activity in a residential home, and that's it. Okay, if you're having an activity in a residential home and everybody's clothed, then let me just show you an adaptation. So let's put your t-shirt on. Let me just sort that out for you. Yeah, so if you just put your t-shirt on. Thank you. The other thing I did, which you would have seen earlier, is I've covered my chair in a blanket so that it's really comfortable and supported. So you can pull that down. Excellent. So again, with the techniques that we used, because there's no oil, you can still do everything that we did. We can still do circles. We can still do petrissaging and squeezing. So it's a little, the emphasis perhaps is a bit more about squeezing and soothing and pressure and pressure. What you might not be able to do is so much is the knuckling, although it works well. So you're going to do everything. Heel of the hand. You can hold the fabric of the t-shirt and do all the techniques that I've just showed you. So you can do, if I show you here, you can hold the fabric and you can do knuckling. You can do heel of the hand. You can do everything, but because it's through clothes, it's not as much physical contact, but it's something that can certainly be done still because it still feels nice. There's no problems, and there's no, what's the word, unpleasantry in having pressure through clothes as well. Certainly if you're working through clothes, you can use your forearm just to do a little bit of pressure just by leaning on. Make sure you've got your palm down. When your palm's down, you're working on this anterior surface, which is fleshy, which is fine. If you did want to make it a bit stronger, and I know my lovely guest here does quite like a firm massage, so I can just turn my palm away from the shoulder, and here now I'm using the ulnar edge, which is much firmer. So I'm just pressing and pressing here. Just one second. Yeah, so here I am putting pressure on, and it's just a little stronger. Is that pressure okay?
That's okay.
Yeah, is it too strong? Is that okay?
Yeah, that's okay.
Okay, good. Is it strong enough?
No.
No more?
I don't mind either way.
Okay,
Yeah.
okay, so it really varies, because if I wanted to go stronger, I could get my elbow in and put, so it just really, you just need to check in and make sure that your guest is comfortable. Whenever I teach this, I always share about, it's called the acromion process and the acromion junction. This is super important because the clavicle and the spine of scapula meet at a junction at the end of the shoulder here, and that's called the acromion process or the acromion junction. And if you were to press on that, that's a bit cringy. So we always stay medial to that, so towards the spine, towards the midline. And so we definitely don't want to lean with either our body weight or our ulnar edge on the acromion. So we stay quite close. So I'll just quickly do the other side, just so to even out. So this is just a nice technique. The shoulder you would do, sorry, the neck you would do exactly the same. So you could do circles and stripes that I demonstrated, on the face and the head. So it's just really a variation for clothed. I'm just going to make it stronger. And I'm just doing a nice juicy on and off. Nice on and off. If it's too quick, if you're going like that, it's quite hectic and it's quite agitating for the nervous system. We definitely want to have a smoothness so that it's a nice on and nice off here. So it's still relaxing and it's still very much a massage. So take your time, and here I'm just putting my elbow in a little bit just to give a stronger pressure.
That's a bit tender there.
There, yeah. And these are acupoints as well. So we've got gallbladder 21 acupoint, like right there.
Yeah.
You feel that? Yeah. Okay. And then we just soothe that off. So nice squeezes and squeezes. Again, you can do a little bit of, so you can do everything. You would just, I mean, obviously if they're wearing a jumper or a pullover, it's different. But here with just a t-shirt or a blouse, or, you know, just a very simple dress, whatever your guests are wearing. But it's difficult if they're wearing a jumper or a cardigan. And then, you know, you would just improvise with what you know. Okay, so I'm going to leave it there for you. If you have any questions, then please do email me or get in touch if you're doing my training for massage for the elderly, and I'll answer any of your questions. So thank you so much for watching, and I'll welcome you to the school anytime. This is an online training course. If you want to jump on theschooloffinetuning.com, it is an online training course you can access. And thank you so much. Bye-bye.